My name is Laura Hawley with the University of Nebraska Medical Center's Munroe-Meyer Institute. I'd like to share some information about internship and practicum opportunities we offer that come with a stipend and unique training experiences. The Munroe-Meyer Institute, or MMI for short, is located within the University of Nebraska Medical Center. Our psychologists provide behavioral health services to children, adolescents, young adults, and their families. We have providers in clinics across the state of Nebraska. We have received funding from the Health Resources and Services Administration, or HRSA, part of the federal government. It allows us to give trainees $15,000 stipends to complete their internships or practicums in our sites. Our goal is to train more providers who work in rural and urban underserved areas and integrated primary care clinics with children, adolescents, and young adults. We provide trainees with the experiences to help them work in these areas. We are focused on increasing the diversity of the behavioral health workforce to serve Nebraska's diverse individuals. We are actively recruiting students from the following training programs: Master of Clinical Mental Health Counseling, Psychiatric Mental Health Nurse Practitioner, Master of Social Work, and Master of Psychology. All students must be in their last year of training and enrolled in training programs in the state of Nebraska. There is a high need for more behavioral health providers in the state of Nebraska. As you can see, a majority of Nebraska's counties do not have enough mental health professionals. Of the professionals we do have, most of them are in larger cities, and many of them are getting closer to retirement age. A large majority of our current mental health professionals identify as white, so there is a need to recruit a more diverse group of mental health professionals. We hope to give our trainees wonderful training experiences that encourage them to stay here in Nebraska and help meet this huge need. I'd like to describe integrated behavioral health in primary care. A lot of times it is shortened to integrated care or integrated primary care, and these terms refer to combining physical health and mental health care together within a primary care doctor's office. Many of our behavioral health providers have offices right in the primary care clinic or can easily be reached for consultation. This is helpful because oftentimes families feel more comfortable sharing their mental health concerns with their primary care doctor. In integrated care, if a patient expresses mental health concerns while visiting with their primary care doctor, that doctor can introduce them to a behavioral health provider during their visit, and the patient can learn what therapy could look like for them if they need it. Having both physical and mental health services in the same building can reduce the stigma a person might feel when seeking out mental health treatment. Trainees in our program will be placed into integrated care or community-based clinics. We partner with a select group of supervisors with experience in integrated care and the developmental model of supervision. Developmental supervision means that you will work closely with your supervisor in sessions throughout the length of your internship or practicum. So interested trainees should apply to us before they have a supervisor in mind. We use therapy that is broadly behavioral, short-term, and solution-focused. This slide shows some of the behaviors you may encounter during your internship or practicum with us. One main category is high-frequency, low-intensity behaviors, including tantrums or non-compliance. Another category is mental health concerns such as anxiety, depression, and OCD. A third category is behaviors at the intersection of health and behavior, such as toileting issues and sleep problems. Another main area is developmental issues related to ADHD or autism, or habits and tics. We have a variety of training sites across the state of Nebraska. Site placements will vary depending on the availability of supervisors. So what type of trainees are we looking for? Any experience with or interest in working with youth is important. So is an interest in working in underserved locations. If you like the idea of practicing a behavioral orientation of treatment while receiving lots of direct training from your supervisor, you are likely a good fit for our program. If you have any questions or would like to apply, you can contact me. My email address is listed here on this slide. I'd like to thank the Health Resources and Services Administration for supporting our program. Thank you all for listening, and I hope to hear from you.